Hi, I'm Tarun. I'll be playing a counselor in training,
Hi, I'm Shrimanti. I'll be the patient.
and today we'll discuss the results of a hearing evaluation session and various management options available. Okay, so we are done with the testing.
Okay.
How are you feeling now?
I'm feeling good.
Good? Okay. That was really tiring, right?
Yeah, it was, yeah.
Okay. But the good thing is we are done with all your tests.
Okay.
So, okay, now I'll explain you the results of all the tests we did.
Okay.
Okay? Alright, so we started with a test called tympanometry. You must remember in which I placed the probe in your ear and I asked you that there will be some pressure changes in your ear,
Okay.
right?
Okay, yeah.
Okay, so the purpose of this test was to see whether your eardrum is functioning fine, is moving or not with the sound.
Okay.
Or in other words, I can say whether your middle ear is functioning fine.
Okay.
Okay?
Okay.
And a good thing is that results are showing that both of your ears, middle ear part is functioning absolutely fine.
Oh,
So that's
good to know. Yeah.
So then we moved to a different test to see where the problem lies, and that test was audioacoustic emissions, or OAEs we call it.
Okay.
Okay, so the purpose of this test was to check your hearing nerve, if it's functioning fine or not.
Okay.
Okay, so we did the test and unfortunately it's giving us a refer value for both of your ears.
Oh.
It means that there might be some problem here, but we were not sure of that.
I see. Okay.
So to confirm our diagnosis, I did another test that was called pure tone audiometry, in which I placed an insert earphones in both of your ears and you were asked to press the button whenever you hear some sound.
Oh, yeah. You mean the beeps, right?
Yeah, the beeps.
Okay. Okay.
So that was the main test in which we checked your hearing at different frequencies and we plot your results on a graph called audiogram.
Okay.
So that's the audiogram. As you can see, here are all the volume levels and that's all the frequencies.
Oh, okay.
So we were trying to check at each frequency how much volume do you need to understand or to hear that.
Okay.
Okay. So can you see this board line over here?
Yeah, I can see that.
Okay, so anything above this board line is considered normal.
Okay.
But you can see in your case, almost at all the frequencies, your thresholds are coming far below this board line.
Okay.
Indicating that you need an extra amount of volume to hear these sounds.
Okay.
Then we did one more test that was a speech recognition test.
Okay.
In which I was asking you to repeat some words after me.
Okay, yeah.
Okay, so initially I started at a normal conversation level and I presented 25 words that you repeated after me.
Okay.
And you scored around 65% of that.
Okay.
But when I increased the volume to reach to your threshold levels, and then I again did the same test, you improved significantly and you scored 95%.
Okay.
That was pretty good. So it's overall, with all the tests, it's implying that you need an extra amount of volume.
Oh, I see.
So after that, I did one more test in which I placed a transducer at your bone behind the ear. That was again a final test to confirm if your hearing nerve is functioning fine or is that the place where problem lies.
Okay.
So after that test, it's actually showing that your hearing nerve has some damages in some areas. And that's why your hearing thresholds are reduced. So it usually happens with age, so that's pretty common thing, so that's not a big concern. And fortunately nowadays we have a lot more technologies to take care of that.
Okay.
Okay? Do you have any questions so far?
Yeah, I mean, I don't really think that I have a problem with my hearing, but like whenever I'm outside in a busy place, like lots of people talking around, and I'm with my friend, and I can hardly hear. I mean, I can hardly understand what she's saying. I mean, is it
Okay.
like related to like this sort of loss which it's showing, or
Yeah.
I have like I have really difficult times like understanding what people are saying.
Okay. So, what do you mean by when you say you don't think you have a problem?
I I don't think I have a problem with my hearing. It's just that I'm not able to understand the speech that well. You know what
Got
they
it.
are saying. I can I can hear that they are saying something, but I cannot say what.
Okay. So,
Yeah.
okay. So, I think what you're trying to say is that you think the volume is fine,
Right.
but you can't understand it.
Yeah. Exactly. Yeah.
Okay. Yeah. It is all related to here.
Okay. I
See, as
see.
you can see, your hearing, it's different at different pitches. Can you
Okay.
see here?
Yeah.
So, on the low pitches, you are hearing comparatively better.
Okay.
And what low pitches do is, it has all the vowel sounds. So it provides the volume or loudness to sound.
Okay.
But when we come to speech understanding or clarity, we need consonants.
Oh.
But consonants lies in higher frequency, and
Okay.
you're having problem mainly in higher frequencies.
Okay.
So your low frequencies are better, so you are getting the volume, but your high frequencies
Oh.
are not that better. That's why you are listening to it, but you are not able to understand to it. You are not able to listen to the consonants.
Oh, is that why like things are not really clear to me when
Yeah,
I'm in?
especially.
Okay.
And when you are in noise,
Okay.
noise is all high frequencies, so you are missing everything there.
Oh.
Um,
Okay.
do you also feel problem, like any difference while you're talking to some male person or a female or a kid?
Yeah, you know what? The other day, my neighbor's daughter, I was trying to speak to her, and it was really hard for me. I mean, I usually don't understand what kids are saying.
How old is she?
She's probably 5 or 6. Yeah.
Yeah, so by the age of 6 to 7 years, kids they have comparatively higher frequencies
Oh,
as adults.
okay.
So now I guess you got it. Why you were having problem understanding kids?
Yeah.
So
Okay.
my recommendation will be that we should go for an amplification option as early as possible, so that it should not deteriorate as faster.
Okay. So, like, what does it include? I mean.
Well, with amplification option, it means that you'll have to wear a hearing aid.
Oh,
Because when I said it's loss in the hearing nerve, it means it's non-reversible. It cannot be treated with any medicines or something.
okay.
So you'll have to wear something additional that will amplify the sound to your ear
Okay.
and increase the volume for you.
Okay.
So do you want to talk about hearing aids a bit more, or
Yeah, I
you want
mean,
to
I
think?
have no idea about them. Like, just briefly, what are they? Like, what types and stuff?
Okay. So nowadays with the technology, there are a lot of hearing aids. They come
Okay.
in different sizes. You might have seen some people
Yeah.
wearing hearing aid behind the ear.
Right.
Some even wear a hearing aid much smaller that directly goes in the ear. So there are
Okay.
different styles and different technologies along with that.
Okay.
But in your case, I would recommend a hearing aid that will go behind the ear,
Okay.
because it has much more features that will help you hearing better in problem areas, such as it has a directional microphone.
Okay.
So what that do, if you are sitting in some noisy situation or restaurant, as you are saying, that directional microphone will cut out the background noise and will allow the speech to increase in volume.
Oh, that
So
will help me a lot.
that will help you, and
Yeah.
it will have a lot of other options like to suppress wind noise
Okay.
and things like that.
Okay.
So that will be pretty useful, and I would like you to consider that.
Okay.
Once you think you're ready for that, we can schedule a different appointment for the discussion of all the hearing aid options, economic, and all the features, whatever you think. We can talk about that in detail.
Well, I think we can just go ahead and, like, if you have any time, like, the same day next week or
Sure.
any time available, and I would probably bring in my husband too to,
Yeah,
discuss the
that will
hearing
be
aids and
that will be
stuff.
good. Okay,
Yeah.
so So I'll mark you for the same time next week.
Yeah, that sounds
fine?
good. Yeah,
Okay.
it works for me.
So before going, there's just one more thing I would like you to ask. Do you want these reports to be sent to your physician?
Yeah, I think that will be good.
Okay, so for that, would you please sign here for me? That's a release form that
Okay.
you have allowed me to send your reports
Okay.
to your physician.
Sure.
Okay, thanks a lot. Also, there are some more links and sources that I would like you to read. There are some extra information on hearing aids.
Oh,
So
okay.
just read that once in this week, so that once we'll have a discussion session next week, you'll have a much more idea about hearing aids.
Okay. Alright,
Okay?
thank you. Yeah.
Okay. See you
Bye.
next week. Have a good weekend.
You too.
Bye-bye.
Bye.